stereotypes linger, a trip to the oral and maxillofacial surgery office is no longer the stressful and painful experience older adults remember. Today's modern oral and maxillofacial surgeons provide patients with a very comfortable surgical environment and appropriate anesthetics to ease their discomfort and anxiety. Most oral and maxillofacial surgery takes place in the OMS office, utilizing minimal sedation, moderate sedation, deep IV sedation, or general anesthesia. The surgeon's intensive anesthesia training, lifelong learning through didactic and hands-on continuing education programs, and their self-regulated office anesthesia evaluations assure that patients receive the safest, most effective anesthesia care available.
Anesthesia was essential for the development of oral and maxillofacial surgery. If you think about it, dental extraction is by far the commonest surgical procedure carried out in the world, and probably in every individual country in the world. And to do it in a civilized manner requires anesthesia of some kind. Before we had anesthetics, surgery, first of all, it wasn't performed very often, and when it was kind of barbaric. Many of the early pioneers in our specialty were in fact pioneers in anesthesia in general, because in a way anesthesia developed by way of dentistry.
In the 1840s, dentists Horace Wells and William T.G. Morton discovered the anesthetic effects of nitrous oxide and ether.
The early pioneers in the specialty of oral and maxillofacial surgery were essentially looking for techniques that could be office-based. So people like Adrian Hubble, Harold Crowe were specifically looking for these outpatient techniques in the 1930s, 1940s, 1950s, and they were instrumental in developing those techniques and making them safe and reliable techniques, and they have certainly been adopted by some of the other medical and dental specialties.